the center is a partnership between Advocate Healthcare and the Office for Community Engagement and Neighborhood Health Partnerships at University of Illinois at Chicago.
Healthy Hotspots is part of an initiative of the Cook County Department of Public Health, and it is part of their WE plan, or what people may call the Community Health Improvement Plan. The focus of that plan is helping to create a supportive environment, environment in which people can be healthy. So the center has had a long relationship with the Cook County Department of Public Health. It began with a Center for Disease Control grant that was focused on reducing obesity. And our work in that particular plan was to work with communities of faith on physical activity, becoming healthy places, eating healthy. And so that relationship set us up for the relationship that we currently work in with this Healthy Hotspots.
The center's work with the Healthy Hotspot Initiative is part of addressing the social determinants of health around community and social context, as well as neighborhood and built environment strategies. As we mentioned before, the Healthy Hotspot, the county-wide Healthy Hotspot Initiative is aiming to have different organizations across different sectors, schools, parks, municipalities, hospitals, become identified as healthy hotspots. And our role in that has been to engage faith communities around these different activities to become healthy hotspots as faith communities. So there are 5 criteria that we're asking congregations to look within their activities and see what they're already doing to become healthy hotspots. So the first one is to improve nutrition. And so they can look to see, do we have any just kind of basic activities? Are we developing any partnerships around healthy eating? Are we making policies in our faith community around healthy eating? And if so, they can check that off. The same with physical activity. Smoking cessation is one. Are we a smoke-free campus? One pastor that we were working with worked really hard with his AA group representatives to help them to bring in smoking cessation classes for the people that were coming to the AA classes, because it was really important to him not just to say we're smoke-free, but to actually work with the AA groups and other groups that were using the building to say that they would also be smoke-free. So an example. The other one is to manage chronic disease, so are they doing classes or screening or education? And then the 5th one is relationships, because we know that social isolation is a really big health issue. It really affects people's health. And faith communities are places that support relationships, and so that's a 5th criteria that we've added. So if congregations can meet each of those areas, then they become designated as a healthy hotspot, and they receive a certificate that we award to them. They get a little decal that goes on their door, and they're a much more ready partner with us as we continue to work on these policy systems and environmental change strategies. There's the healthy hotspot thing overall, and then there are initiatives that we're carrying out in specific communities that have been identified as priority areas because they're low-income, high-need communities.
So part of the work that we're doing with in the South Suburbs is with a ministerial alliance that we identify in that community, and the leader of that network is actually interested in places being healthier. We initially wanted to work on the congregations, and his advice was to work on the leaders. And so we worked with Advocate Healthcare System to set up a clergy wellness initiative, and are working with them and their network to try and encourage them to create a policy that establishes a group within the network that really continues to focus on health and wellness for the ministers and for their congregations. And that minister also happens to be working with healthy stores, corner stores. He's received some funding through another initiative in trying to bring healthy food into this community, which is a desert. I think their last store just closed, and so it's really important that those corner stores offer healthy food for them.
And through his network, we've also been able to do chronic disease self-management groups for people in their network and in the community, and also something called a Vitality Cafe, which engages members of their faith communities and community members in really thinking about what it means to live a vital life of vitality. So sort of a broader idea about health beyond just healthy eating and physical activity. Building on that, we also worked with a neighborhood in the western suburbs, mostly Latino, African American, sort of a mix, Latino, African American, and white community. We were also able to connect them with a funding source to also work on the corner store initiative. So they had a staff person who was working with the corner stores to help to build their capacity to provide fresh fruits and vegetables and other kind of healthy options, make them visible in the store, and also work with people in the community to get them to go and buy things at the store, which is one of the major barriers for corner stores being willing to do that is they feel like people aren't going to buy it. And so one of the pieces about having the faith communities involved is that they have the connections in the community to help drive people to those stores.
So one of the things that I think is very important to lift up is that the interest in these changes in social determinants, because it's a practice of faith, and being able to align our public health interests with the interests of faith communities was important. And so as a practice of faith, people are interested in their own wellness, interested in the wellness of their communities.